Hey, everybody. I hope you are all doing well. Quick announcement. I'm taking some time off. This is what people call a vacation. I've heard of these things. I haven't done one in a while. So, like going to a beach house next week. So, we're not going to have class. But I picked out some choice Richard Lord recordings for you guys. So, if you have the hour free, and we'll send you a link to some information. Richard talking about protein folding, amino acids. There's like a couple lectures. So every time I'm out, we're going to dose you guys with a Richard Lord lecture so you can kind of fill in your knowledge base there. And then there's going to be 3 weeks throughout the summer that I'm out. One in June, July 4th week, I always take off. And then there's a week in August I'm going to be out too. Okay, so anyways, that's coming up. You guys will get an email with all the scheduling on that. We have a lab here from John, which we should look at first. And then I wanted to open it up for a discussion. But let's grab John first here. John, you there?
How about now?
Hey, there you are, sir. Nice.
Very good. Very good. Okay, so uh, I've been studying with you since before you met Richard, and I thought I had a pretty good handle on the ion panels, but they've made some changes, and I don't quite know what to do with it. Uh,
All right.
specifically, starting with the creatinine level.
Oh
Um,
yeah, let's take a look at that. Uh,
so, and then this patient is quite quite difficult, and any advice that you can give me would be greatly appreciated. Uh,
John, there's some weird background noise. I'm not sure what it is, but there. No, now it's gone.
I'm going through pages.
Oh,
Uh,
that was actually sounded like electronic. Yeah. So questions. Should we start? The creatinine. When Metametrics was running these at the Atlanta lab, you had to do the adjustment on your own. But now the way that they're running them in Asheville, the creatinine is sort of taken care of. So you don't have to make these adjustments based on the age or sex or size of the person in any way. Um, they're doing that for you.
okay, so this one, and I was looking for it. It's 6. The creatinine level is 6.
Yeah, and they should have adjusted all the markers around that already, so you don't have to worry
I
about
see.
that. Yeah.
Okay, very good. Um, and so, do you want a little history here, or shall we just look at the lab and
Well, yeah, just let me know what the main questions are. It sounds it's a cancer patient that's been through.
she's had cancer 3 times. She's on 25 different medications. Uh, she's including narcotics 5 times a day. She's on also benzodiazepines at night to try to sleep. She is on uh, prednisone. She's on thyroid medication. She's on a heart uh, verapamil medication. Uh, the she's got a lot of GI issues as well, which I didn't even get on there. But the narcotics, of course, are causing constipation, so she has to take some stool softener, Senna and Miralax, to try to keep her bowels moving. She has uncontrolled sweating. She has shaking, dyskinesia, and she's depressed because she's in pain and nothing seems to be helping. She's from a small town in northern New Mexico, and uh, she says she's, I guess suicidal is maybe extreme. She doesn't want to continue living the way she's been living, but she's a very strong Catholic and will not, I don't believe, take any action to end her life. Her husband is very supportive, but there's not much that he can do. I've tried to suggest a drug holiday. Her physician said we don't do that. Um, but it seems like there's no way to get through uh, the medications um, that I have been able to figure out. I tried her on a small dose of uh, uh, the neurotransmitter support. I'm sorry, the name of it is escaping me right now. Um, the one from Designs, and it
Hmm.
seemed somewhat helpful. I can do hands-on acupuncture and manual treatments with her, but they don't last. Uh, Sometimes not even until they get back to their home 30 minutes away. Uh, so moving up from the creatinine, if we take a look at her GI markers, I don't know. I mean, we can start kind of anywhere and everywhere. I just don't know where to try to
Yeah.
intervene, at all to try to move the
So I
needle.
would I would I would just try to support the systems that she needs to process all the medication here.
Okay,
So
that makes
because that,
good sense.
if they have to be on the medication, that's the reality. So let me just show you here because this is pretty and shouldn't be harmful, if you do it right, but should allow her to just, have her liver work a little better. It may mean that if you're successful, she needs less, of some medications. That'd be nice.
That would be
Um,
great. Yeah.
Here, let me show you here. This is a good diagram right here. So that way you're not really doing a treatment, kind of. You're just really doing support so that she can handle all these drugs that are hitting her. And so this is a nice image. I like this one. So there's a lot of oxidative stress. She has every one of the oxidative stress markers, sky high. So you know that there's damage happening. Obviously, she had cancer. There's all kinds of damage happening to her DNA. Um, and we want to work with, just restoration of the basic cell functions. So you think about restoration of the function of the cell membranes and the mitochondria as kind of key, and then the liver detox pathways themselves. So the way that Timmons would put it is that the cell membrane is kind of the decider, of toxin movement and flow. And I think one thing he drilled into me is that the weaker that the person's cell membranes are, the more environmental toxins, in this case, it may be not from the environment, but from medications, the more that the cells are just going to be negatively affected by, metabolites or things that are potentially harmful. And that the better the integrity, the more that you can improve the integrity of the cell membrane, the more your cells can just work right. So, and that comes back down to, fatty acids, I guess. And just forget what the lab says, even just to get, repair going with some kind of, omega-3 type fatty acids, just to get that process started. And then so that those fats or lipids don't get destroyed, you have to protect them from all the oxidative stress that's happening. And you can see that all over the lab because their lipid peroxides are high, all the different markers that you'd expect were screwed up in regards to cell protection. And then I think so that's like one big picture thing. I just always when I think someone is becoming toxic because of medications or because of environmental exposure, the first thing that pops into my mind is, cell membranes. And of course the mitochondria have a double membrane, so they're like even more important. to get membranes working. The other kind of super product for that is because this is kind of what we're trying to prevent with her, which is oxidative. We want to just reduce the oxidative stress, inflammation, tissue, and cell damage. Just try to take that down a notch by getting her systems working better. And it's that whole Michael Ash thing, with the let me show you Michael Ash with the lipid replacement therapy. It's kind of hard to find these products. You might have to hunt around a little bit, but you can look them up easily. So there's Michael Ash. Where is Michael? Here he is. Who's a well-known doctor in the UK. He kind of leads up the whole functional medicine movement in the UK. And then he's done some research on this subject. He doesn't not talking about as much as he used to, but he used to talk about it all the time with lipid replacement therapy. And so he's got some specific products that he designed for this purpose years ago that are it's basically a supplement that's designed specifically just to fix the cell membrane. So fish oils would be like the entry level version of this, and then Michael Ash's stuff would be the more advanced version. And let's see if we do Michael Ash lipid membrane. And I used to buy his product. It's I don't think they have it at Fullscript, so it's a little challenging to get it. You have to kind of hunt around a little bit. Let me show you here. And there's other companies that have kind of copied what he's doing here. And this is his partner in the research projects that they've done. Membrane lipid replacement for chronic illnesses. And I mean, you can't go wrong just getting the membranes better. That's not going to impact, because what you don't want to do is give her something that's going to impact with, in a negative way with the medications that she's on. Because there's like, if 25 medications and potentially suicidal, you're fraught. You don't have any room for, having a reaction. So I'm thinking of like super safe but super effective things. So something around this membrane lipid replacement, and it's a powder, and you just chug it down twice a day, and doesn't taste that great, but anyways, you just kind of get it in your system, and that's something I think that could help her tremendously, and that is low risk in terms of side effects. So this is membrane lipid replacement therapy stuff. So that would be the first thing that I think of, and then
All right, is there an actual product there?
Yeah, and I just can't find it now. Let me see if I can find it. Michael Ash. They have one at Fullscript that I used to order, but I don't know if it's as good as the one that he designed. Let's see. It's like NT factors or something like that. Let's see. I don't see it anymore. I wonder if he's not selling it anymore. I don't know if anyone on the call uses his stuff, but lipid replacement therapy. I don't see it online now. It used to be, and let me see if I can find NT factors. Oh yeah, here it is. Is this the right one? I can't find it right now. Let's see, maybe somebody knows. Oh, here, Membrane Man Quicksilver. All right, here we go. This is a knockoff product, but let's look at it. Let's see here. God bless Chris Shade. I don't know what we do without this guy.
He's one smart dude.
I know. We should all buy his products because, he's just a gift to the profession, and we really want to support his business. Let's see. He thinks of all these things. I didn't even know he had this one. It's crazy diversity of thought here. Nano emulsion. He always makes it a little bit better than everybody else. It must really piss off the other companies. Yeah, lipid membrane. Here we go. So Michael Ash I don't even know if Michael's making it anymore. I couldn't find the NT factors. Maybe it's off the market now. But it looks like he took the NT factors idea and made it better with this, emulsified blend. It's probably absorbed a little bit better, I'll bet. So again, like you can load up any chronic patient with this stuff. And that's like almost half the battle there just to get the membranes working properly. And it's a global correction, right, for every cell and every mitochondria and everything. So I think that's super safe, but super effective. And then the other thing at that highest level is amino acids. Her amino acids were just all low anyways, yeah?
Yes.
So then free-form amino acids in a form that, she can handle. Obviously, Pure has them, Designs has them. I use them for metabolic maintenance sometimes if I can't find the other ones. And just starting to trickle those in. So then you've got protein synthesis happening, repair. So you've got cellular membrane happening with that product, the Quicksilver one, and then you've got protein synthesis happening. And the only other thing you need that's sort of magic sauce for the amino acids to work properly are the B vitamins. So like just a simple, B complex. So that's like, one phase. And then if you look at the other parts of this, let me see if I can find another diagram real quick. Then you can get into like, okay, what's really happened given the fact that she's on all these medications? Because sometimes the medications become the problem, not the solution,
Well, that I think is a huge factor for her, and hence my request from her physician to put her in the hospital and put her on a drug holiday. But he just
Yeah, that's kind of,
I don't think he'd ever even heard of that.
no, that's not,
Frankly.
yeah, you have to have like a naturopath in charge to make that happen. But back in the day, down in Mexico, Timmons and those guys used to do that, but they had a whole hospital with a bunch of MDs running around. So here's, so then the question becomes, okay, out of all these different pathways that help you get rid of medications, which ones are the most screwed up? And I think for a patient like this, it's worth like treating individual pathways. So I saw the glycine marker was the problematic. So you know right off the bat, there's something going on with the glycine related pathway. And you can get, I guess, any of these aminos really in individual dosages. So you could do glycine separately, you could do NAC separately, you could do glutathione separately, rather than the combination products, figure out which of these pathways you want to support the most. And with a general background of the B vitamins, and then the antioxidants, based on the labs too. So let's look at that here, because you can see a lot of this on the test, so you don't have to guess so much about the pathways. Let's see here. So it's basically just like a helping you tolerate your medications program. So the benzoate hippurate ratio is far off, so we know right off the bat, look, that's not even detectable. That's
Yeah,
fantastic.
that
So
is.
that's glycine. So I would start her like at 1,000 glycine a day, maybe a few weeks or a month later, go to 2,000 a day, maybe another few weeks or a month later, go to 3,000 a day, and then just keep cranking it up, just really gradually, by 1,000 milligrams every 2 to 4 weeks, and see if you can get up to as much as 6,000, and see if she starts to, as you're, 2 to 4 weeks on each dose, maybe her liver is going to start to clear things a little more effectively. She should come out of this haze that she's in. So I think it better to do that. And then if you give her 1,000 glycine and she gets a horrible reaction, then you just put that aside, right? So that you're not using the combination products, using individual ingredients, so you can get them to super therapeutic dosages. And then if there is a reaction, you know which one it is, which product it is, right? You could do something similar with magnesium. Her quinolinic is high.
Okay, her magnesium levels are high.
Oh, on this test?
Yeah.
Yeah, then I would still give her like a baseline of magnesium, but maybe not try to crank it up.
Okay,
And then you
300.
can use CoQ10. You could use CoQ10 for sure, because I think her lipid peroxides are high, which, not surprising, and glutathione is low. So then the glutathione opens up. We already have the glycine in there. You could do the same thing with NAC individually. It doesn't really matter, I guess, which order you do this in, but you could do the NAC like 1,000 milligrams for 2 to 4 weeks, then 2,000 milligrams, and then go up to 3,000, and just see if there's a, just gradual increase that she can tolerate. And then if you get to it, maybe you get to 4,000 NAC, and all of a sudden she's starting to feel better. Just hold it steady there. But I would just start really low with like 1,000 for the first 2 to 4 weeks, and just see if her liver can actually come back and start to work well. And then so now we got NAC and glycine, but you're doing it one at a time and gradually increasing them. And then you could use obviously glutathione itself, could be in there as well, so another option. And then for the lipid peroxides, either vitamin E or CoQ10, and the same basic strategy where you're just gradually increasing the dose every 2 to 4 weeks and seeing how high you can get away with, and seeing if there's a threshold where all of a sudden she starts to actually feel a little bit better. Um, so let's see, that's 3 things. No, that's 4 things maybe. So it's lipid replacement therapy for the membranes. It's free-form amino acids for cellular repair. She can just make proteins again. It's B vitamins to kind of potentiate everything that we're talking about. And then antioxidants kind of customized based on the labs, NAC, glycine, um, and CoQ10 or vitamin E. Those all seem pretty harmless to do. And I think the thing is just to try to get, gradually creep the dosages up until you start to get some kind of beneficial effect where she's actually feeling a little bit better. And then you don't have to worry about, it's more adapting the person's body to handle all the medication. And then maybe as she starts to feel better, the hope is that she can peel off some of the medications gradually. So a couple years from now, maybe she's on 17 things instead of 25, or it's just sort of a gradual reduction of the, what they call it, polypharmacy, I think is the term they made up.
Yeah, this is polypharmacy on steroids.
Yeah, and just see if you can, see if you can do that. People
Um,
can still respond. It's amazing how robust some people are, even in the face of all this stuff. Anyways, that's probably what I
so,
would do. Like a really graduated program, but not being afraid to slowly titrate up to therapeutic dosages, and then tossing out the stuff that she reacts to poorly and just moving on to other items.
so the Cravorest was what I had her on
Yeah,
briefly.
you can use Cravorest too if she feels okay on it. I wouldn't bring the dosages of that up too high because that could have an interaction with some of the medication. But that 6 a day, I think you're okay.
All right, well, that is quite a bit of stuff right there.
Yeah, hopefully that's going to help. And let me grab Pedro had a comment here too. Let me grab Pedro. Pedro, are you there? Let me bring this up. Uh, Dr. Pedro, I got you unmuted here. Let me see, he had a comment about this doctor I don't know. Uh, oh my gosh, hang on a second. Diane, I can't pronounce this name
I
here.
can you hear
Oh,
me
there
now?
you are. Yeah, tell us about that
Okay.
doctor then.
Yeah, Dr. Diane Goodenow. He has been working with plasmalogens for decades. Plasmalogens are phospholipids that we produce in our bodies. However, we cannot get them through dietary sources. They're present in colostrum, but unfortunately, when it goes to and in meat as well, but when it goes through your stomach, through the acid, your body, for some reason, don't they get the nature. So he has created and patented plasmalogen precursors, and he has proven how these precursors increase the level of plasmalogens in your body. And he has a lot of data and studies about how low plasmalogen concentration in your body can cause uh, lower life expectancy, cancer, dementia. He has also proven that even in patients that have markers for Alzheimer's, ApoE genes, if they have robust levels of plasmalogens, even when you have the genes, you might not present with the disease. So your chances to have dementia will be decreased if you have optimal levels of plasmalogens. And he recently created a product that is phosphatidylcholine made of egg yolk oil, and it goes through the blood-brain barrier, goes through your brain, gets absorbed pretty well. And he has done great studies and great results with patients with multiple sclerosis, and being able to improve uh, the volume of the gray matter. And it's a very it's a fascinating topic. He has physician roundtable group membership that they present like insane cases once a month. Uh,
Hmm.
I think it's a good resource for people that wants to work. Also, if another resource for like membrane and lipid restoration protocols. Uh, I think it's a good addition for people that have inflammation and another thing to explore. It's another rabbit hole. Let's put it that way.
Yeah, but what's
I
the
will say
product?
that he,
Is it on here too?
yeah, you can go to Prodrome Sciences. That's his company.
Okay.
Uh, Prodrome Sciences, and you'll see his line of products.
Have you started to use them in your own practice?
I've used it in my practice, correct? I take them myself too. And with great results. And even patients that have, for example, because like 40 to 30% of the membranes on your myocardium are composed of plasmalogens. So patients that have like myocarditis, whether from COVID or vaccines, we treat them with that higher doses. Patients that have like elevated C-reactive protein that are very inflamed, because it's pretty much all your concept about like peroxidation of membranes, triggering autoimmune disease. So
Mm,
giving patients this type of protocols will help turning the fire down on the membranes and keep autoimmunity at bay. Um, and yeah, these protocols are fascinating. He's been on multiple like conferences. He's going to be actually in the Peptide World Congress this weekend and cellular medicine conferences. He's pretty well known in the community.
that's a great product. I wonder if you would use it in lieu of the lipid membrane replacement therapy or together with it. What do you think? Is it
Oh,
the
you can use it all along. This thing is I even give it to my daughter. My daughter is 3 years old. I give her Glia because one is for gray matter
Hmm.
and one is for white matter. So if you have a patient with MS with some like ALS, you give them high doses of Glia, which is the white matter one. And patients with dementia, you give them the gray matter. I mean, you can give them both. It's the more the better. Um, and I mean, I can introduce you to him. And this guy's, I'm part of his membership group, and this guy's fantastic. So he's a
Yeah, yeah.
genius.
I'd like to talk to him. That'd be great. Maybe
In
you could.
my in
This
my
is a great.
opinion, he's like the Dr. Richard Lord of plasma of like phospholipids, and
Hmm.
he has his own proprietary lab analyzing all lipids. It's pretty fantastic.
Yeah, that would be very interesting. I haven't heard of him before. This is a great, and it's such an important thing. If he's made a breakthrough in how to get membranes working better,
Yes, he has a book
you
that
know.
is called Breaking Alzheimer's.
Hmm.
And that book, he publishes all the data. He did studies in with Rush Medical Center here in Chicago, and he basically published all his like life work in that book. And it's kind of like a good introduction for providers that want to learn a little bit more of that. But it's
Okay.
it's it's very comprehensive. For us that are doing this type of approach and working on cellular medicine and working on these pathways, I think it can move the needle in many patients, especially patients like the one that we just discussed right now that are very
Hmm.
complex, that have like membrane peroxidation and inflammation. Some of the
Excellent.
yeah,
Yeah.
some of the calls the other day he did one call where he was treating a patient with cancer, and he did like he's using pathways that of even medications that are already existing. For example, metformin, rapamycin, those are mTOR that control mTOR inhibitors, and helping patients with cancer using certain specific protocols. And doctors from all over the world just like sharing what they're doing, so you can get a
Hmm.
little bit of everything there.
That is super helpful. I haven't heard of him before. I'm really glad to learn about this.
Yeah. You're gonna get into a rabbit hole, and you know so much about this topic already that everything is gonna make sense for you. Very easy.
Yeah. Excellent. Pedro, thank you so much. Let me see. Oh, Elise
Yeah.
uses them. Let me grab Elise too here. You guys, this class is so helpful. Like, how would you find this stuff otherwise? It's not even a class. It's more like a group here. Elise, you there? You use this in your practice too?
Yeah, we use it as well. People that are starting to have some symptoms of, dementia or just brain fog, really. Any kind of issue like that, we'll put them on that, and they seem to do pretty well on it. It's been a good product. It's
Prodrome,
well,
this one, the Neuro one, is the one you use mostly, or
yeah, Prodrome Neuro. Yeah,
is that different than what we were just talking about? No, this is the same thing. It's just a different product.
yeah,
Yeah, it's the same basic idea as the lipid replacement therapy, huh? It's just more sophisticated, maybe.
yeah. It's great stuff.
Oh, excellent. All right. And let's see. I don't know if this is in, I don't know the Dale Bredesen protocol, so I don't know if this is in those or not. But this is super cool. All right. Um, well, that's helpful. All right. Let's see. I think John, you probably have more than enough ideas now. John, you there? It was a good discussion. But are you all set now for your patient? Let's see if we get John there. Well, we lost him for a second, but anyways, hopefully that should be plenty for that patient to get started with. And okay, that's the only case that we had. So I don't know if you guys have other topics you want to discuss. Just type in something here. We can really talk about anything. It could be literally anything. Just get a discussion going. When we're kind of focusing on, maybe it's, if I was going to lead off, I would say, like, what are your biggest pain points in your practice now? What are the two things that are just like making your practice not as much fun as it should be, and trying to problem solve those. And it could be either business or clinical. I mean, a lot of the things that trip up people, I think, are more business related. Oh, John, you there? Yeah, you all set?
Yes, I had just one more comment on the ion panel. It seems that both with the homocysteine, the toxic elements, and the CoQ10 plus vitamin profile, they're no longer using quintile. It's just,
Yeah, they shifted over to this other machine that they're using. So they're printing NutraVal data on an ion panel format, basically. That's what's happening.
so might as well just use the NutraVal at this point. It seems like if it's not different equipment and it's,
Yeah, it's pretty much the same information. Yep, just with a
yeah,
different display to it.
okay. Thank
Yep.
you.
Mhm. Those old machines are gone now. There is a company though, US Biotech. You guys use them? Does anyone here use them? But let me show you here. If you're really attached to the ions, these guys are still running them. Our tests, Nutristat, I think is what they call it. Nutristat complete profile from US Biotech. Single profile, 242 markers. Let's see if they have a sample lab. And it's a little more than an ion used to be. Let's see. I know they have a sample test in here somewhere. Just can't find it here. Oh well. We can just look at the summary part here. Which is basically everything that we're used to and then some. It's kind of like a cardio ion plus plus. Let me see if I can get one. I have one on my computer somewhere. US Biotech Nutristat report. Here it is. Sample. Here. All right. And they do a ton of other testing there, obviously, but let's see where to go. Nutritional. Here. They also have a basic profile, but here's the complete one. And this should look pretty familiar because it's the exact same thing. So it's like the cardio ion, right? So they have all the cardio markers here, which you guys are familiar with. Kind of handy, dandy, including homocysteine. And then they go on to all that stuff, kind of traditional testing. They include a thyroid panel on here. They throw in some of the other hormones. And then metals. And then here's fatty acids, amino acids, as we're used to seeing them from plasma. And then the whole basically organic acids that we're used to seeing too, right? Adipic, subearic, ethylmalonic, pyruvic, lactic acid, all this stuff, citric acid cycle, and all that good stuff. The keto, alpha ketos with the B vitamins, methylation markers. You can see it's pretty much a direct copy of Richard Holt's death. And then into antioxidant markers. So this is pretty similar. And there's another one that's a little easier to wrap your mind around. Let me see if I can find that one here, which is their basic here. Their basic is not so basic, but their basic profile here cuts out a lot of that other stuff. But you can see here, metal. This is more like an ion, their original ion. So without the cardio part, without the thyroid and all that. Fatty acids. And then amino acids, it's just a different order for everything, right? And then organic acids. So that company's available too. And let's grab Amy. She had a bad experience with them. Amy, you there?
Hi, Dr. Kalish. So yeah, I'm a big Ion fan, and I was super disappointed when they changed the Ion. So I tried, I went over to US Biotech and I ran probably like 8, maybe 10 Nutristats and like 6 GI Advanced, and I had a really bad experience with them. I don't know if they're just going through growing pains because they have new management, but they made a lot of mistakes. They kept sending the wrong kits and poor communication. Like my rep would give me different information from other people in the company. It was kind of like a cluster fudge, and I gave up.
When was that? How long ago was that?
It was about maybe 5 months ago or so.
Oh, it was recently.
Oh yeah, it was. I had a really bad experience. I was tearing my hair out. It was so frustrating to deal with them. So I went back to my usual
Okay,
Ion.
well that's good to know. Maybe they need some time to get their act together.
That's what I was hoping that, maybe they'll improve like in a year or two.
Okay, all right, that's good to know. Thank you. Okay, let's see. All right, that's good there. Okay, so pain point. Somebody throw out a pain point in your practice. What's like the hardest thing that you guys struggle with? And anything business or clinical could be either. Let me see. I can call on somebody. All right, let's grab Michelle. Michelle's smart. Michelle, you there?
Thank you.
What's the hardest thing in your practice now? I mean, you've been super successful already, but what's holding you up?
Well, my two biggest things are I feel like I'm very privileged with my issues, but one, I just can't handle how many emails my patients try to send
Mm.
and just like little tiny questions. And because I have such high turnover of patients, it's just every day. It's like, I woke up this morning and there were 47 emails.
So you answer?
I don't have any staff. And it might be time for that. But I try to train my patients to just, you have to bullet point me. If I'm going to take more than 2 minutes to answer the email, you have to book a session. But then I'm booked out for like 2 months. And so then they're like, well, I can't get in. I have a quick question. So it's just
Oh,
a
yeah, you can't do that. You can't do that. That's so much time. It's so much stress. I'm having anxiety just hearing you talk about it.
I know it's frustrating.
47 patient emails
Yeah,
in
there are a
one
lot.
day?
Yeah.
Oh,
And
that's
they're
so messed
easy.
up.
Like, what magnesium citrate do you recommend? Or, they're not, it doesn't take a long time, but it's just so many. And every year it just adds up because these patients, I think they like me and they want my advice and they like to buy supplements from me, but it's just never ending. And I feel like I can't really hire someone unless they know the like Michelle Hirsch method, because I do have a favorite magnesium citrate. And
Well, how much longer do you want to be in practice? I guess that's the question.
maybe
Like, are you
2 months.
I mean, if you've got another 2 years and you're going to retire, then it's not worth fixing this. But if you're going to be doing this for a while, then
I mean, my
if we're
husband had a bad accident this year, so I'm supporting my family, so I can't quit anytime soon.
okay, well then I would get an assistant and you just train them. And
Hmm.
all you have to do is answer every question once, and then they put it in a procedure manual.
Hmm.
So when they quit, you have a procedure manual. So
Hmm.
you definitely don't. The thing you don't want to do with staff is have anything be a black box that's in their head that only they know.
Uh-huh.
So you just hire somebody, I don't know, for $25 an hour, somewhere in that range probably, and you have them start to respond to these emails. And but you have to have them create a frequently asked questions procedure manual thing while they're doing that. So they're cataloging it all for you. And then
Yeah.
you'll only answer, then every question that gets asked, you only answer it once the rest of your career. And then what happens, I have, Jennifer is my version of this. And then once in a while, people ask things that she's never heard the question before. And so I get maybe, I don't know, an email every couple weeks or something.
A lot of
I'm
times the
exaggerating. I
questions
get a
are,
couple emails a week. I get a couple a week, max, a couple, but like 2 or 3 emails a week total. That's the max. Because there's always something new that's odd that comes up or that she hasn't heard of before. But 90% of the questions are the same stupid questions over and over and over and over again.
a lot of times though, it's about the protocol, and I feel like it's my responsibility to at least look it over, or if they're having a bad reaction or something. And also I'm just so underwater right now, it seems like it'd take a long time to train somebody. That's even
Well,
more else.
well, I mean, the that's a consult. If you're having to think about things, and you're just
Yeah.
too, basically, you're just too busy. What are you charging now per hour?
Not enough, but I about
Yeah,
300.
300?
Yeah, I think I have to raise. I think that's going to be the solution. I've tried to
Yeah,
be fair, and Amy always tells me I'm not getting paid enough. And I think the more when I raise my rates, it will get easier.
yeah, I would go to 450.
Hmm.
Yeah, just go to 450. You know, it's gonna just eliminate so many problems because
Yeah.
you're so far under. If you go to 4, then you really should be at 450. I mean, you're just too far below the rate. I mean, the common rate now I see is 650. People are charging that all. Used to be just in New York City, but that's all over the country now. People are doing 6 or 650 an hour. So
It seems really
you're half
mean
price.
because then I just get white rich people, and that's not what I'm looking for. But I understand, and I've been really heavily relying on the supplement sales, and I do make a ton of money there. But I think I need to switch something because I'm literally looking in the mirror like, wow, you're burning out.
Yeah. It's for sure going to happen. You can't do 47 emails a week, let alone a day. It's not realistic. But you can fix this. You just have to, if you slow the train down by raising your fees, at least go to 400, but 450 would be better.
I'm
But
gonna
then
do that.
if you go to here, but do the math, right? Here's the thing. Like how many, this is everybody. Lenny used to have this conversation with me every year. I hated this. I hated this. Lenny would do this every year, and he was always right. I would never wanted to raise my fees ever. Can't believe I'm doing this to you guys now. I hated this. Lenny used to do this all the time. Lenny charged $750 an hour for his coaching, and every time I complained about it, he's like, "Well, how much money did you make this month?" And I'm like, "Okay." Every time I talk to you, Lenny, I make a lot more money. Okay, it's worth it. So let's say you have how many hours a week of patient contact?
Uh, well, I have a different job also. So I do about 20 face-to-face hours.
20. Okay, let's just use this as an example. So 20 hours times 300, right? Is $6,000 a week. Is that right? Yeah. So 20 hours times 300 an hour is 6K a week.
Well, then I charge a reading fee on the test, and then there's the supplements.
That's good. So that's like extra money. That's good. But let's see then if you go to 450, 20 times 450. Oh, 20 times 450. That all of a sudden is like $9,000 a week. So if you lose, let's say 15% of your patients just go away, or let's say you cut your hours back by 20% time, because that's what you have to do when you're burning out, right? That's gonna, so 20% of $9,000 is, that's easy, that's 1,800. Yeah, so minus 1,800. So if you do a 20% reduction in time at $9,000 a week, now you're making 7,200 a week. So in other words, you could cut your hours by 20% if you raise your fees by 450 and still make a bit more, you know.
Mm-hmm.
Or you could, I don't know, either start charging for the emails.
I was thinking about that too.
It's a little awkward. I never liked doing that. I tried that once. I would just look at a clock and the number of minutes I would do, I would have a fee for the email responses. I didn't really like that though. I think that the assistant is probably your best way out of this, but you're not really ready to do that yet. So the other thing is that you could raise your fees to 450 and say it includes, you know, limited email responses or something, and you can respond to it, you know, so you're charging kind of, but in a global way. So why are you raising your fees? Because I'm spending so much time doing email. So it's 450 now, and you will do, like, you got to limit it though, you know, like 5-minute email response per week per patient or something like that, you know.
Yeah, and you know, it's a lot of times it's like the specific patients. I'm trying to weed them out more on discovery calls. I can just tell. They're going to tell me like every time they went to the bathroom.
Well, yeah, so for those people, that's a whole different problem. So
Yeah.
for those people, you never respond to their emails,
No, I
right?
just write you can book a session at this link.
Yeah, exactly. So those people, you just got to cut them off completely. Otherwise, it'll just escalate to a living nightmare.
You know, Dan, you're doing such a good job. Would you like to be my assistant?
Yeah, really.
Thank you for hearing this out. And again, I feel really privileged. Thank you for training me so well so I can be in this position.
Oh, you're very welcome. Yeah, I'm super glad. And everyone struggles with this patient contact stuff, you know. Oh, the other thing you can do that people are, you know, super popular these days, you can also do a membership where, you know, for an extra couple $100 a month, they have email access to you, and otherwise they don't. That's pretty popular these days. Like $199 a month for limited email access. You know, you got to define what that access is, like how many emails and what to do with it. But that's another way to do it. And then for the patients that, you know, you can't see on a regular basis because your schedule is full, you know, you can end up still staying in touch with them, but they're paying for it. $199 a month for this kind of membership access. Let's see, Alexandra had a comment here too. Alexandra, you there?
Yeah, I was just back to the plasminogens. You mean, oh, plasminogens or this topic?
Oh, just questions you had, yeah, about practice.
Well, no, I was just saying that I finally got a good assistant. Well, yeah. And she, like you just said, she sees how I'm answering. Like I'm now not even on my patient portal. I was handling the portal at one point and it was just driving me crazy. And so I said, okay, well, let's do this for a month. I'll answer these questions, you take note, and so then you can answer them. So it worked beautifully. And I love the idea that you said membership and then the emails. That's what I think I would do if I was in Elise's position. But whatever.
Yeah, the thing is, like, think about it. Let's say you have, I mean, the math on this is crazy. If you have 250 patients, most of you probably have that many, try to keep it simple. Let's say you have 250 patients paying you $200 a month. Doesn't sound like that much to an individual patient, but all of a sudden, you know how much that is? It's a lot of money, man. It's like 600 grand a year. I'd answer emails for that much. Then all of a sudden it's like, oh, 47 emails. I don't know. I just made $1 million last year. It's not so much of a headache, because that's 50 grand a month. And then a lot of people don't take advantage of it. We were talking about this in terms of business models. Somebody was joking, this is the gym membership business model. I'm like, yeah, you're right. So people join the gym and then they never go. Most people never go. There's like 20% of people that join gyms that actually ever go and work out. So a lot of people that pay the membership fee never use it. They're just not those kind of people. But if they have to reach you, they want to be able to. And then you get a few people that overuse it, so you have rules in place so that, there's some guardrails around that. And then there are some people, the problem is that there's the overusers, there's the people that never use it, and there's the people that Michelle is worried about, and I know these people, who actually do need to be in touch with you. And it's better for their case, it's better for your treatment success if you actually can have an open line of communication with them. You don't need to have a 20-minute consult, but they're people that you care about and they're asking reasonable questions that are actually important. And it's better for you to answer those in real time than to wait 2 months until the next appointment, because things can go south. And so there's a small segment of these people that actually need the service. And those are the ones that you really want to be in the membership, so they feel like they have access to you. They don't have to wait 2 months to ask these questions. As long as you have, a rule book around what the accessibility means, to how often they can reach out. I think that can really work. And then people don't want to join the membership to have the access to you, then they don't have to. It's not a big deal. Anyways, this is my ideas for you guys. I'm going to take off now. Oh yeah, we're out next week, and then I'll be back the week after. All right, bye for now. Take care.